And now, here are your Health Talk hosts, Kay Murray and Jim Stallings.
I am Jim Stallings, and she is...
I am Kay Murray.
And we are your hosts of Health Talk.
Yes, good morning.
Here on WAJR, brought to you by Mon General Hospital. In the studio with us is Dr. John Azar, medical oncologist and the medical director of the Zelda Stein Weiss Cancer Center at Mon General Hospital. Good morning.
Good morning. Good morning,
welcome
Bill.
to the program. And in the studio also is Heather Colbank. She's a nurse navigator.
Good morning.
Do you fly the ship?
No.
Okay.
Not at all.
All right, that's what the pilot does. You kind of help the pilot navigate. There's no question about that. Let's talk about the Zelda Stein Weiss Cancer Center of Mon General. There is a new lung cancer screening program that we're going to be talking about today. And Dr. Azar, if you could tell us about this new lung cancer screening program. Sounds like it's pretty exciting for Mon General and the community.
Good morning. Good morning. Yeah, it is exciting. Lung cancer is very prevalent in West Virginia. Actually, unfortunately, we are the third state in the country that has the lung cancer problem. You know, ahead of us is Kentucky and Mississippi, but it is very prevalent, and I see a lot of cancer patients, lung cancer patients, and usually the prognosis is not good. When they come to see me, the cancer is advanced, and we can help them, but there is a big portion of patients where we cannot cure them, and this is the problem. We've been trying to screen for lung cancer for a long time now, many decades, and as clinical trials, we have used all kinds of modalities, chest x-rays, and so on and so forth, and the screening has not been successful. And, you know, like in breast cancer, we have the mammogram, and colon cancer, we do colonoscopies, and we can detect those cancers early, but this has not been the case in lung cancer until recently. We have a very nationwide trial, and actually it is an international trial, but it was sponsored by the National Cancer Institute. It is the most expensive clinical trial to date. It cost the country $250 million to finish the trial. And this trial established beyond any doubt that there is a role for lung cancer screening with low-dose CT scan.
What do you think the difficulty has been in early diagnosis of lung cancer?
Well, the difficulty is been in chest X-ray. Chest X-ray does not show us the nodule or the mass early on, and the mass has to grow beyond a certain size, and when it is a certain size, you cannot possibly, or most of the time, you cannot fix it. The CT that we do can detect nodules early on, and we can tackle it with surgery, remove the lung cancer before it becomes a problem.
And if it becomes a problem, is it past that early detection stage? Because doesn't the patient start developing some kind of symptoms? Is that too far along at that point?
Yes, yeah, when the patient develops symptoms, it's too far along. So there are criteria to screen for lung cancer, and those criteria have been adopted by major organizations. And just recently, I forgot the name of this, the health, it's going to come back to me, but the major organization...
CDC?
No, it will come to me, but it's the Preventative Task Force, U.S. Preventative Task Force. It advises the government. It's very conservative, and this is the task force that at some point a few years ago, they said that we need to do the mammogram at the age of 50 instead of 40. So they look at things really conservatively, and they don't issue any statement unless they have solid clinical data. And this time, a couple of weeks ago, they came and they unanimously endorsed the lung cancer screening nationwide. And I think it's going to be a matter of short time before it becomes adopted nationwide. And, you know, I am proud that in Mon General Hospital, we've taken a proactive role, and we started doing the screening early on at this stage.
Early detection has always been the secret for curing or trying to help people with cancer. With lung cancer, people that have smoked for a long time, most of us wait until we're having some kind of a side effect or we're not feeling well, then we go to the doctor. If you're a smoker, is this someone that needs to have this done immediately, or are there certain requirements to meet?
If you are a smoker, you are at risk for lung cancer, and it is a tremendous risk. It's about 25 to 30 times more than normal population. Even people who quit smoking are still at risk up to 15 to 20 years. So the criteria includes people who are currently smokers and people who have quit smoking less than 15 years. So if you're a smoker and quit smoking 14 years ago, you can still be screened. You are still at risk of lung cancer, and according to the criteria, you should be screened.
Heather, you're the nurse navigator for the lung cancer screening program. Talk about what happens if I come to you and I need to get this this CT done. Exactly what will you do? How's it work?
Okay, you can do a self-referral to me. You can actually just call the number. The number is 304-285-3500. You can self-referral to me. You can actually get an order from your primary care physician. Either that, or I can have Dr. Azar. He's agreed to be our medical oncologist and sign the order if they don't have a primary care physician at that time. But they can actually call me. I can set up their CT scan. We can schedule it right over the phone. Right now there is a cost until it is approved, like Dr. Azar had said. The cost is $95. That includes the low-dose CT scan, one-on-one follow-up with me, and a smoking cessation program all at the same time. Now, if you quit smoking, obviously that doesn't apply. But yeah, all you have to do is call me. I can call your primary care physician. The patient really does not have to do anything. I will do all the work for them to make sure it gets done.
When we come back from the break, let's talk about what's involved in a CT scan for lung cancer. And your phone calls are welcome at 304-296-0041. This is Health Talk, brought to you by Mon General on WAJR. Do you meet eligibility requirements for the lung cancer screening program at Mon General Hospital? We're going to ask Dr. John Azar, our guest, that question next. Also, Heather Colbanks in the studio. She's a nurse navigator. So let's talk about eligibility requirements, Dr. Azar.
So Heather knows a little bit about eligibility requirement, but it's easy. It is current smoker and people who have quit smoking less than 15 years ago. You know, if people had a couple of puffs here and there, it's not they're not eligible for screening. And what we do 30-pack year history of smoking. That's the number that we go by. And 30-pack year history, meaning that if they have one pack for 30 years, or let's say 2-pack for 15 years. This is how we do the math. And anybody that has 30-pack year history of previous smoker less than 15 years ago, or somebody who is currently smoking for any amount of smoking, those patients would be eligible for the screening. Now, as far as getting the test, we cannot just order the test because under West Virginia law, we need to have a physician order to get any X-ray or radiologic test. So it's best to have the primary care physician refer the patient. But like Heather said, if the patient does not have a primary care physician and they want to do the test, I will personally review the criteria, and if they are eligible, I will write the order for the test. So we have talked about the method of screening, which is a low-dose CT. And like Heather was saying in the break, this is a very easy test. It doesn't require any dye. And people who are, let's say, have some concern about allergic reaction to dye or exposure to radiation, it is not the case here because the exposure to radiation is minimum and people don't have to get an IV dye.
Do you just lie down on a table and a machine scans you?
Just lie down on the table and it's like, I think 5 to 10 minutes and it's done.
For you, you could take a nap, Jim.
I will take a nap.
Yeah, take a little nap. We're talking about the smoker, but there are individuals that may be in workplaces that they would have a risk factor. Would there be another type of a risk factor that would apply to this, Heather?
Absolutely. We have 2 criteria. You actually do have to be a smoker for both of the criteria. The first one is age 55 to 74, smoke 30-pack history year, and that's all the criteria for the first one. The second one is age 50 to 74 or quit within the last 15 15 years, smoked at least 20-pack year history, so that's 2 packs per day for 10 years or 1 pack for 20 years, and then also have an additional risk factor such as COPD, pulmonary fibrosis, and occupational exposure, coal miners being big in West Virginia, and then even a personal or family history of any kind of cancer puts you at that higher risk.
And you mentioned those that have quit smoking. What was that spanned?
15 years, the last 15 years.
I've always heard that, and of course we see the pictures in school of the black lung and the pretty pink lung, and those that want to quit and they have such a hard time. But we've been told that if you quit, will your lungs, doctor, go back to being a pretty pink lung? And does that heal the lung if you quit smoking over a period of time?
If you quit smoking, you're going to get benefit from quitting almost immediately. So on a week or two after people quit smoking, they start breathing better. The smoking gives you a lot of problems, including hardening of the vessels, heart problems, lung problems. You know, once the damage is done, it can linger and stay on for a long time. So this type of damage to the heart and the lung and the risk for lung cancer stays behind. And studies have shown that up to 15 years, people can be at risk of lung cancer. This is why we have the marker at 15 years for people who want to, to quit smoking. But quitting smoking is really important, and there is no need for people to look at screening if they don't have the intention to quit smoking. This is a big part of helping our patients in the community benefit from this test, because as a big part of the test, we're going to help them quit smoking too.
The lungs are just a very unique organ. I think of them as being fibrous with a lot of capillaries and those types of things. Now, when you find cancerous cells within the lungs, aren't they very hard to detect? As I would imagine the CT scan is doing a pretty good job detecting those. But if you find some cancerous cells, are they easy to remove?
Well, the lung is, like you said, is a very delicate organ. We cannot just cut away on the lung tissue like other tissue. Like, for breast cancer surgery, we can do breast conservation. And, if the woman, we have part of the breast taken out, the woman can live a normal life pretty much and not have any breathing issue. But the lung is different. It's a delicate organ. We cannot cut away. So, the answer to your question, no, it is not easy to remove. So it is very delicate. The test is interpreting the test is involved, but there are some methods that we do, like bronchoscopy, navigational bronchoscopy, and so on, to try to spare the patient surgery. And we have those procedures that we can do at Mount General Hospital, and we are increasing our portfolio of procedures that we can do with limiting the injury to the lung.
Our number is 304-296-0041. Those that have lung cancer and it's advancing, does cancer expand from the lungs to other parts of the body easily?
Correct. This is how people die from lung cancer. They, if undetected, there will be cancer cells in the bloodstream that will go and deposit in different organs like the liver or the adrenal glands or even the brain. And the screening is meant to detect the cancer early, so it will not grow to the point that it will be in the bloodstream. And the clinical studies have shown that the cancer that we detect on screening is caught early on. So there is what we call in medical term downstaging. So we are finding cancer at an earlier stage where we can remove it and cure it.
Is it likely to return?
Well, the earlier the stage is, the less chances of the cancer returning. With even our best surgery, even if the cancer is really early on, there is a substantial risk of cancer returning. So the earlier we catch it, the better it is for the patient.
Dr. John Azar, our guest this morning, medical oncologist and the medical director of the Zelda Stein Weiss Cancer Center of Mon General Hospital. And you're listening to the Mon General Hospital sponsored program Health Talk on WAJR. Welcome back to Health Talk on WAJR. We're talking about the lung cancer screening program at Mon General Hospital with Dr. John Azar, medical oncologist and the medical director of the Zelda Stein Weiss Cancer Center at Mon General, and Heather Colbank, a nurse navigator in the studio.
Yeah, in fact, she wants to navigate your lung. We were just talking in the break about another test. It sounds like something like a video game is how you described it to me, Heather.
Correct. Dr. Azar had mentioned it earlier. It's easier to get to the nodule. We have an EMB machine at Mon General, and what the pulmonologists are the ones that mostly use it. And what they do is when they detect the nodule in the lung, they can use the CT scan. They can navigate down through a bronchoscopy and actually follow it on the CT scan on the screen. They have like a little controller, just like a video game, and they go down and they can actually take that nodule without doing an open surgery. So it makes it much easier to get the nodule out of the lung than it ever used to be.
You're very good at this. You just painted a picture and I understood that. That's awesome.
Yeah.
Let's talk about the cost of the program. $95. And tell us what all that includes.
Absolutely. If they meet eligibility requirements and all they have to do is call me, I can tell them if they do or they don't. $95 includes that initial cost of the CT scan. That'll give you your low-dose CT scan, one-on-one follow-up with me. I will call your primary care physician. We will get you an order one way or another, and then also a smoking cessation program on top of that.
$95 can save your life.
Absolutely.
It really could save your life. And then afterwards, sooner or later, insurance pops in here too.
Absolutely. Insurances will be covering it soon. There's been articles come out in the last 2 weeks that say, Medicare and Medicaid are going to start paying for it, then commercial will pick up after that. But early detection, 85% of lung cancers can be found in the earliest, most curable stages.
And again, how do we get in the program?
All you have to do is give me a call, 304-285-3500.
Current smokers, former smokers.
Absolutely. And if they don't meet criteria, I'll let them know that. But give me a call. If you meet criteria, we'll get you in and get you scheduled.
One thing that was very important that the doctor said, and that is if you're not ready to quit smoking, this is not the program for you.
Absolutely, because this is an all-inclusive program, and we have a smoking cessation program to go with it. The intention is to cure people or to find lung cancer at an early stage, and if you have somebody who is actively smoking, this means that they are not committed to their health, and therefore it doesn't make any sense to go through the lung cancer screening program.
Yeah, perhaps the best way to quit smoking is if you know someone that has lung cancer from smoking their whole lives, and I think that's a wake-up call for a lot of people.
Or carries an oxygen tank around with them everywhere they go. I've seen a friend that does that too, and it's very difficult. And they said, if I'd have only known earlier.
Exactly.
So this is the message.
I mean, the message is out. People are quitting smoking more and more. So you don't see a lot of people anymore. The rate of smoking is going down. But nevertheless, people who had smoked in the past are still at risk for lung cancer, and we should be able to include those people in the lung cancer screening program.
So as lung cancer continues to be the #1 cause of cancer-related deaths in the United States, the Zelda Stein Weiss Cancer Center of Mon General Hospital is now offering a new low-cost screening program to help patients who are at risk for lung cancer, and now you know all about it thanks to our guest in the studio this morning. Heather, thank you so much for coming in.
Thank you for having me.
You're a very good spokesperson.
Yes.
Thank you.
And a navigator. And also, thank you, Dr. Azar. We appreciate
Thank you
your
very
help
much.
this morning. You've been listening to Mon General Hospital. A video of this program, complete with illustrations, will be available online at the Mon General website, mongeneral.com. Stay tuned for Morgantown AM, the talk of the town, coming up after the news next on WAJR.